Today, we're tackling a really critical public health question right here in the United States. What's the actual mortality risk for patients after a hip fracture? Well, a massive new study has given us the clearest picture we've ever had, and honestly, some of the findings might surprise you. Let's start with just one number, 300,000. It's a huge figure, but what does it actually represent when it comes to American healthcare? That's how many hip fractures happen in the US every single year. And think about this. As our population gets older, that number is only going to go up. So this is a really urgent challenge. This brings us to the big question researchers have been trying to pin down for years. What is the real risk of dying in the hospital after a hip fracture? Well, this study finally gives us a number, 3.9%. So how on earth did they land on such a precise number? They used something called Epic Cosmos. Now, this is not your average data set. We're talking about a colossal, totally anonymous database with records from over 280 million patients. It gives us this incredible coast-to-coast view of what's really happening. And this is where the scale just becomes mind-boggling. The study didn't just look at a few hundred cases or even a few thousand. They analyzed over 1.2 million separate hip fracture admissions. That makes it one of the largest studies of its kind, ever. And after crunching all those numbers, the main finding across all 1.2 million cases was an overall inpatient mortality rate of 3.9%. Let me put that in perspective for you. For every 100 people who are admitted to the hospital with a hip fracture, almost 4 of them don't get to go home. But 3.9% is just an average. The real story, the part that can actually help doctors save lives, is in the details. So the study dug deeper to answer that critical question: who is most at risk? First up, when we look at the breakdown by sex, a pretty clear pattern emerges. While women have more hip fractures in general, they also make up a much larger share of the in-hospital deaths, almost 60% of all cases. Now here's where things get really stark. Age is one of the most powerful predictors, and the risk doesn't just climb, it skyrockets. You can see it right here. The rate jumps from just under 4% for folks in the 65 to 74 group, all the way up to almost 6% for those 85 and older. That's a huge leap in risk for our oldest patients. Okay, but the data on race? This is where things got a little unexpected. In this absolutely massive data set, white patients actually had the highest mortality rate at over 4.4%, while Asian patients had the lowest at just under 2.6%. And you know what? The researchers themselves urged a lot of caution here. They say it directly in the paper, quote, "These findings contrast with previous studies and should be interpreted with caution." It's a really important reminder that powerful new data can sometimes challenge what we thought we knew, and it often just leads to even more questions. All right, so we've looked at who is most at risk. Now let's switch gears and focus on where. The study also created this fascinating national map of risk. This leads to a really fundamental question, especially in a country as big and diverse as the US. Does your zip code actually affect your risk of dying in the hospital after a hip fracture? To figure that out, the study carved up the country into 4 main regions. You've got the Northeast, the South, the Midwest, and the West. And wow, the results are pretty dramatic. The South accounts for the largest share of these deaths, over 38%. The Midwest isn't far behind at almost 32%. Now compare that to the West, which only accounts for a little over 6%. This shows a huge geographic difference in patient outcomes. So we have the who and the where behind the risk. But what does all of this actually mean for patients and for doctors working on the ground? It means we can start to build a really clear picture of the highest risk patient profile, at least according to this study. The person with the highest statistical risk is a female who's 85 or older, is white, and lives in the South. But here's the most important takeaway. This research isn't just about finding problems. It's a roadmap for action. By understanding these specific risk factors and where they're most concentrated, healthcare systems now have the data to build better, standardized care plans that can improve survival rates for everyone, no matter who they are or where they happen to live. And that leaves us with this one big, forward-looking question. Thanks to this study, the risks are clearer than they have ever been. So the challenge now is, how do we take this knowledge and use it to truly change the outcome for one of the most dangerous injuries our elderly population faces?